Hi there, my name is Dean Morgan. Thanks for watching my film about saving money in healthcare. This program is called Standard Medical Co-op. Originally, I designed it for Obamacare. Obamacare is right here. This is the original outline to Obamacare. Printed it out yesterday, and it's only one page. I thought it was 2 pages, but it's only one page. And it was designed specifically for the doctor and designed specifically for the patient to save money. The doctor makes all the money, this facility makes all the money, and the patient saves money. And also it's designed for the new doctor that just came out, that hasn't been working or just getting out of school and doesn't know where to go. And this doctor will be able to get work immediately and make money automatically. There are millions of people out there that don't have insurance, and millions of people out there who can't afford insurance. Coinsurances and out-of-pocket expenses are way too expensive. Nobody can afford that. It's just impossible to get $5,000 or $10,000 deductible, and you can't afford to pay the payment. So for $125 a month, you can pay your basic odds and end payment to a Care Now or urgent care or a doctor who decides to be on this program. It's much better that way. Cheaper. Go to the doctor, have a sniffle, need some antibiotic, fine. Otherwise, you got to go to the doctor and pay $150. No one wants to do that. Who wants to pay $150? The doctor only gets $75 of it anyway, or maybe $80, somewhere around there. It depends on the hospital, or it depends on the doctor. It depends on the insurance company. But as I understood from all these years of doing insurance, and there's been 36 years of it, I understood how people make money in insurance, and so I decided to make this program available to the public and as well as available to the doctors to save money for the public and make money for the doctors. And that's basically what it is. There's no pre-existing problems. If you're pregnant now, it's okay. If you got AIDS, cancer, heart problems, it's okay. Everything you got, it's okay. It's covered. A co-op is designed if you have a surgery situation that you want to go to get a surgery, you go get your surgery. Now, if one facility doesn't do it, so go to a different facility. It'd be nice to get a referral, but does not necessarily have to have a referral. But that doctor has to be in the program, just like anything else, he has to be in the co-op in order for that to happen. A lot of the older doctors may not like this program because it doesn't pay as much as the younger doctors will be getting paid. However, it's still affordable for the doctor to do it, and in this way he's got some income, and it's affordable to the patient as well. People just don't understand sometimes how the insurance works, and I get that. And a lot of times the insurance companies built these large $100,000, $200,000, $500,000 bills that no one could afford or pay anyway. And who's going to want to pay it anyway? Nobody. So you get the situation in the hospital where the hospital pays the payments. Gets the payments from the patient directly and on a 24-month basis. At least to get income from it, and then the affordable income for the people who can afford it. If for some reason you're out of work for 6 months, okay. But it has to be legitimate. You have to be able to verify work. Or if you have you can be on a family plan, which saves a little bit of money. And a family plan, if you have a wife, you have a spouse, and then you want to save a little bit of money, you save about $25 a month each person, which is okay. Also, if you have a child, the same situation goes for that. Child costs around $75 a month, and the base is like $125 to $150 a month for a regular person for this program. You get to go to the doctor twice a month, and if you need to go 3 or 4 times, it just costs $35 more each time you go. This is not something like a HMO or PPO. It's not even insurance lingo. This is just a basic fee-paid basic program. It's really designed to where you live. If you live in one specific spot and there's a Care Now or facility or a person in the co-op that's close by, he'll be the one that's setting it up. I have a program that's a billing program specifically that will take care of all our needs. And the program is basically through a billing system where it'll actually be able to take care of all the billing for you, including the doctor's billing and whatnot. If the doctor's company or facility already has a billing program that they want, that's fine. We'll set it up to where everything is running smoothly and whatnot. Ransolve is our company that we're going to be using for our program. They're global. They're a worldwide company. They can take care of all our needs and take care of all our situations with all the billing, from the doctor to the hospital to the clinics. The first 2 years, we're going to basically concentrate on the clinic side to make sure this is a smooth transition. Then, as we get bigger and as the things get growing, we'll start working on the doctors and the surgeries and whatnot, because there's more complications and all that. And we want to make sure that all the doctors are doing what they're supposed to be doing, and all the facilities are doing what they're supposed to be doing and billing out properly, and not overcharging the patient and whatnot. No one wants to be overcharged for the facility or whatnot. You don't want to be overcharged for that. It's not necessary. If you're out of town, you want to go like to Oklahoma, Mississippi, Chicago, wherever, and they're in the program, go. It's no problem. You need an X-ray, you just pay the X-ray fee, which is roughly around $35. Normally, it costs a lot more if you're working with an insurance company. And there's no co-insurance, no co-pay, no out-of-pocket, no major out-of-pocket. If you have a prescription drug issue, all this easy stuff that you normally get from the doctor, the amoxicillin and whatnot, you can get that at the clinic. The clinic, you should be able to sell it right then and there, $10, $20, boom, boom, boom. That's it, you're done. You don't have to worry about waiting in line, going to get a prescription. They just have it there. They'll give it to you. That's it. You just pay the $10 or $20. That's all you got to worry about. It makes it much easier that way. Who wants to go waiting in line to get a prescription? However, if it's a very complicated drug, you're going to have to go get it anyway. I mean, you have to go to get prescription drugs, and that's just the way it is. You have no choice. The program will be up and running very shortly, probably by January, February of this coming year, 2020. We'll have it at least here in the Texas area, and the doctor and hospitals will come into play again in about 24 months. Advertising is basically, if you already have advertising going for your company, you'll have to add this to your program. If you want to be in this program, you need to add this to your program. It makes it much easier, much cheaper. It's just add right to it. I will give you some flyers and business cards and whatever to get up and running. Ransolve has a situation where eventually, if you get big enough, you can put a small kiosk in your facility where the people can sign up right there in the facility, without having any problems. Just fill out the paperwork, or it's actually going to be a computer kiosk, and then knock it out that way. That's down the road, but eventually, if somebody wants that program, they can get into that program as well. There's no cost to get in the program; it's free. It's just a matter of getting implemented to the system and whatnot. There's no obligation to this program. There's no cost. It's just the key is the facility makes the money, and the patient saves the money, and the patient could afford the monthly payments. And the patients go out, they can't work or whatever, and they have a situation for 6 months, and they've been working all this time. And then we'll work through that situation, so they won't be on the street and dying or whatever. That's just it's a sad story, especially with people that are homeless and whatnot. It makes it bad. We don't want to go crazy with the situation, which I realize that people off the street might be coming in every 5 seconds for something. You don't want that either. I get that, and a lot of doctors will be inundated with people that are always a hypochondriac. Oh, I got this problem, I got that problem, I got this problem. Well, you have to limit yourself to, like I said, 2 times a month, at least for the first 6 months, and after that, we can work maybe to four times if everything works out good. I haven't got a bonus situation where after a year, if you don't use the insurance at all, or I say insurance, if you don't use this program, it's not insurance. If you don't use this program at all, you get a whole 6 months free, because you're going to get 12 monthly payments, and they're not going to be using the program. You should at least give them 6 months free after that for all that money they paid in. So that's just an option. We're discussing through that situation. But anyway, I appreciate you listening to this. My phone number is 214-280-5626. That's 214-280-5626. My attorney's name is William Johnson III, and he's out of Dallas. Thank you so much. Have a nice day. Bye-bye now.